Hello, and welcome to today's virtual event. I'm Carol Feig of Answers Media Network. Thanks for joining us today. On this event, our panel of experts will discuss and provide insights on balancing the integration of AI models with security risks. This event is brought to you by Answers Media Network, a multimedia channel dedicated to covering current and emerging issues driving change in healthcare delivery. The network includes our Health IT Answers news site and our Healthcare Now radio and podcast channel. You can explore all of our content on healthitanswers.net and healthcarenowradio.com. And by Trust Commerce, a Sphere company. Trust Commerce provides a simpler, tech-driven patient payment experience to improve revenue for providers, ultimately leading to better health outcomes for patients. Learn more about their integrated payment processing and solutions at trustcommerce.com. Here is our agenda for the next hour as our panel discusses current and emerging external and internal threats, governance, ramifications of AI-driven security breaches, and how you can enhance your defenses incident responses. If we have time, we will take questions towards the end of the hour. Moderating today's discussion is Matt Fisher. Matt is a proven and experienced legal leader helping organizations navigate the maze that can be the healthcare industry. He's also the host of Healthcare du Jour, one of the longest running radio shows on our Healthcare Now radio network, and no stranger to moderating many of our events. Always welcome him back. Joining Matt is Heather Randall, the Chief Compliance Officer at Trust Commerce. Heather brings 2 decades and a wealth of knowledge and experience to the payments industry. At Trust Commerce, she's responsible for ensuring that all products, platforms, and processes enable and support compliance with regulation and industry standards. Alongside Matt and Heather is Andrew Carr, Senior Director, Incident Response Business Development at Booz Allen Hamilton. His 16-year career in cybersecurity includes roles in digital forensics and incident responses, governance, and academia. During his career, he has led hundreds of incidents and negotiated multi-million-dollar demands with scores of threat actors and groups. And rounding out our panel is David Finn. David has spent nearly 4 decades in the healthcare industry as a CIO and a privacy and security leader. He's a principal owner of Cyber Health Integrity, LLC, and a member of the Strategic Advisory Board of First Health Advisory, where he focuses on cyber resilience and digital health. So, okay. Matt, I'm going to turn it over to you, and I'll talk to you all at the end of the event.
All right, thanks, Carol, and thank you for everybody joining. It's always great to be able to talk about security issues and especially the intersection of security and artificial intelligence. Because if you're talking healthcare nowadays, if you don't mention AI, then it seems like you're not doing your job. Um, you know, but before we kind of start really getting into a lot of that discussion, I'll let each of you provide a little bit more of your backgrounds to kind of fill in some of the blanks that Carol might have left. And also, it'd be great to hear, what each of your connections is to healthcare and, why you're in particular paying attention to the intersection of security and artificial intelligence. So, Heather, I'll turn it over to you to kick it off.
Sure. As Carol mentioned, I have close to 25 years of experience in compliance within the payment space. And so the payment space is unique because we sort of sit at the intersection of a lot of different regulated industries because of the nature of our business. We work often with merchants or organizations, governments sometimes, that have very unique regulatory requirements around their business. And so as a business partner, it's up to us then to make sure that we're supporting that. So I've been working with obviously the data security sort of aspect of it in the payment space, but also privacy, healthcare regulations as well to ensure that we do enable and support compliance moving forward. I'm also a PhD in public policy and public administration, so I'm kind of able to bring that lens as well in the formation of our policy and working with our clients to help ensure that we're advising them in a compliant way.
Hey, great. Thank you. Andrew, why don't we go to you next?
Yeah, so Andrew Carr, thank you. So I come from a practitioner background. I started off in the public sector at a crime lab regionally here in New York. I then moved into academia as a cybersecurity professor and got pulled out into incident response by a friend of mine. And so there I led DFIR teams. I was a ransomware negotiator. And I guess kind of my claim to fame is I have a case I worked back in my criminal work days that is a Lifetime movie and another one that's a Hulu true crime miniseries. So just trying to bring the practitioner lens from an incident response perspective to a discussion like this.
Those are some pretty good claims to fame. I don't know if any of the rest of us will be able to top that. But David, let's turn to you to round out the panel.
Yeah, no movies about anything I've done. My name is David Finn, and I'm very excited to be part of today's panel on AI and cybersecurity in healthcare. I am particularly interested in how artificial intelligence is transforming the way we deliver care, while also raising new challenges around data security, privacy, and trust, which is what healthcare runs on. I am a recovering CIO, a healthcare CIO, and a former privacy and security officer. And I came to healthcare originally through systems and operational audits. So I was about controlling systems and processes. I've spent the last 20 years of my career focused on security and privacy in healthcare. And this field of AI is evolving very fast, particularly in healthcare, from predictive diagnostics to protecting sensitive patient information. And this intersection of innovation and protection is where I've spent most of my 40 years in health IT.
No, great. Thank you all for the introductions and describing your background. So, I think to kick off the discussion today, I think from my perspective, it would be great if we turn to external threats as the first area to dive into. It's it used to be you would go and see a couple breach notifications a couple times per week. Now it's on a daily basis, and usually that daily basis includes multiple reports. And one of the more common causes that are identifying that is some type of cyber attack, or outsider getting access to a system. So if external threats are kind of near or at the top of the list, what are those external threats? And then given that we are talking about the intersection with AI, how is AI factoring into what is happening from that threat perspective? So Andrew, I'll turn over to you to kick us off.
Yeah, so certainly, the rise of ransomware has increased the propensity for kind of these large scale breaches. When I first got into the incident response space, ransomware was kind of in its early days. There wasn't the double extortion of stealing data along with the encryption event. Most of the kind of data breaches you saw were as a result of a business email compromise, an insider threat, or something simpler like that. But now with ransomware gangs, seeing how lucrative this can become, and how much more resilient organizations have become to fend off the actual encryption event, they've had to resort to more significant leverage tactics from an information perspective. So we have seen almost every group now will perform some sort of secondary extortion of the theft of sensitive data with the threat to publicize it. Healthcare, unfortunately, is a prime target for both the encryption event as well as the information theft. The encryption event, obviously, you can't have hospitals down for weeks at a time. Providers can't be unable to treat their patients. So their mean tolerable downtime there is very low. But also from the data theft perspective, the information they have is very sensitive. I used to negotiate ransoms, and I had a threat actor send me as part of their proof of life, proof of theft of data, a 700,000 row spreadsheet of diagnosis information of historical patients. It is something that they know can net them quite a big payday. And so they have, laser focus on trying to get that really sensitive information. And then from the perspective of AI, we have seen, the vastly improved phishing emails and tactics like that, and reconnaissance on targets, with AI's introduction and the ability to have that program craft those things for you.
So Heather, would you like to jump in?
Yeah, I think the point to my mind is that it just accelerates the threat sort of evolution, if you will, because now we have this ability to make these very sophisticated phishing attacks, because we can aggregate data at such a faster pace than we could before. We can, drop data into a Gen AI and say, create a profile for me that is believable in this environment within this context. And so that threat of the ransomware, the double, the encryption and the ransom attack, it just is accelerated. We have deep fakes now, not just videos, but voice as well. And so the idea that we have to be so constantly on guard now, not just against sort of these expected threats, but threats from areas where we had previously kind of maybe felt comfortable. Well, I will recognize this person's voice, or if they send me a video, I'll know who that is. It also accelerates the ability of the bad actor in terms of vulnerability discovery. Just not necessarily from that social engineering aspect, but from the technological aspect as well. So those zero-day exploits they're faster and closer than they've ever been before.
Yeah, and I would just add that the bad guys are using AI for the same reasons we all are. It's smarter, faster, and you don't have to work as hard. We talked about the phishing emails. Heather mentioned the deepfakes, which led CISA and HHS to issue a warning to healthcare help desks not that long ago. And the AI generated malware. And because you can use these tools now to write some of your code. There's a long lag time on most malware anyhow on a hospital network. And so it's actually seeking out the high value targets while it's lurking out there to optimize the damage it can do or what it gets out of it, I guess. So it is making life more difficult from a security perspective. Well, it's also there's the converse of that. We're using AI to help protect ourselves as well.
And it also, I apologize. I was just going to say it also increases the likelihood of an external but unintended security incident, because we may have vendors that are using AIs in ways that we're not aware of. We may have AI in environments that we're not aware of that are picking it up. And then what are they doing with that data? And is that data adequately protected? So there's that sort of unknown aspect of the AI threat as well.
Yeah, and the big gap there, I mean, we saw Change Healthcare last year. We saw some of those other third party risk and the supply chain, the software supply chain, how easily it can be taken down. And now AI is being leveraged in that. And we don't even always know who our AIs are talking to or what they're sharing. So it becomes not only a greater privacy risk, but other security attacks can devolve from that.
And those are great points. And it seems like you're kind of both going that direction of full awareness of what tools are operating within the system, and as well as governance, which I definitely want to get into those areas. But first, kind of want to dig into a particular question or a particular issue that came up implicit in what you're all were talking about, that AI is being utilized to generate phishing emails and deep fakes. So are there measures or is there education that an organization can do to train its users or its workforce to be able to detect or look for signs that one of these that an attack or a message might be being perpetrated through use of an AI tool?
From my perspective, I would say it's a lot of the same things that we've always told people, right? It's validation of a request. It's picking up the phone and calling someone directly if there's a request for payment or whatever it might be, right? You're going to have to be a little bit more diligent. You're not going to be able to look for the obvious misspellings or grammatical errors and those types of things. But there are unique aspects of AI writing that can be picked upon. Sometimes you just feel like, I don't think that sounds like that person. It sounds like a person wrote it, but maybe not that person. And that's kind of where that, spidey sense, I guess, if you will, should pop up and have you just, I want to double check on this. Additionally, as attackers use AI, security tooling is also using AI. It's using those things to more quickly analyze information, more quickly respond to it, and provide better context to the people kind of on the other side of the screen reviewing that information so that they can kind of filter through the noise and find what is relevant.
And I think to sort of follow through the discussion around training and awareness and sort of that spidey sense, all of the regulations that we deal with say you have to have security awareness training, right? You have to make sure that the training is relevant and current. So if you're not renewing your awareness training and its content to account for things like AI, for example, I know a company that before anybody was allowed to use anything with an AI tool, they had to have a training course on AI. What were its benefits? What were its sort of drawbacks or potential threats? So I think that level of awareness, constantly looking at your governance program, including the training and awareness part of it. And as Andrew stated, the use of AI within that defensive technology as well. I think it's interesting. The FTC last year had a voice fake challenge where they invited people to demonstrate how you can detect AI automated voices and use watermarking technology and things like that. So just as we're here sort of lamenting the fact that the bad guys are using AI in new and innovative ways, so is the cybersecurity front. So absolutely, defensive technologies can be used as well.
Yeah, and I think that's kind of the overall point. Healthcare's always lagged in this area, but AI is going to make it imperative. We need to shift from a reactive defense to a proactive, intelligent threat detection. And that probably means adopting some AI-powered security tools, not against outside large language models, but using your own network activity, anomaly detection, integrate your threat intelligence platforms. We've seen some of these AIs that encounter a protective defense, and they simply go around it. So if you're using multi-layer defenses, you can stay ahead of it. One thing that we have never fully mastered in healthcare is the assessment. And even if we do it well, we do it once a year, and that will not be adequate in the world at the pace of change. So you're going to have to do regular security assessments, particularly around your AI. MDR, there's new and better tools. Some of them leverage AI within your environment. And then, Heather said it, at the end of the day, security is a people problem. And you've got to do data validation. You've got to train your staff with AI augmented simulations. Let the AI write your own test fish mails and that kind of thing. But it is a multi-headed snake out there, and so it isn't a once and done thing.
And I'm so glad you brought up MDR, David, because I think a lot of people see AI as, like every other tool that's come before it, this silver bullet of we're just going to let the technology do it all for us, right? And it's definitely something that's going to supplement and it's going to improve things. But, managed detection response, a big piece of that is the people with eyes on glass. And the biggest thing with the phishing is having that person sense that something's wrong about it, right? We can't replace the human element, and people are always going to be involved, especially in healthcare. And so understanding that this is a way to augment our abilities, augment our defenses, and potentially improve them is very important, but we can't ignore the fact that people are still going to be involved in that chain, and we have to focus wholeheartedly on the education and training of those individuals to assess these new threats.
Yeah, and those are all great points, especially as all three of you kept coming back to that the human element is kind of the linchpin to all of it, because as you said, we're not all going to be replaced. We're all going to be here using these tools to enhance our capabilities. So I think that then goes to Heather and David, where both of you were starting to go a minute ago around thoughtful utilization and deployment and integration of the tools. So what does an approach a good approach look like as an organization is not just thinking about, but in reality putting these tools out into the wild? Because as David, you said, it's unavoidable, and there are probably more AI tools already being used in every healthcare organization than all of us are aware of. So what do we need to do, and what should the industry be doing to start catching up and building in the right infrastructure and governance to help minimize or mitigate against risks?
I think you hit on a great point when you talk about using governance to mitigate the risk, because I think oftentimes we tend to look at technology sometimes as wholly separate. especially if it's a new technology. We tend to look and think we have to govern this differently. We have to manage this differently. It doesn't fit into our existing compliance or governance framework. And the fact of the matter is your governance framework is the best way to sort of make sure that you're doing that in a way that works with your business model, that works with the regulatory obligations within your organization. So my first thought would be, don't abandon your existing governance framework. It's there for a reason. It served you well. But I would definitely take a look at that, observe that sort of in the context of the regulatory environment that's happening as well. Now we have something like 40 states that have posed new regulation around AI. And to a point that both Andrew and David have made, transparency, getting human eyes on something before you make an action with it, whether it's a security related action, whether it's a decisioning action with respect to patients or clients. And so I think, making sure that you're incorporating that through your third party risk management, through your regular risk assessment, whether you do that on an annual or semi-annual basis, making sure that you maintain those practices that help keep you safe on a regular basis as you're adopting this new technology, and then informing all of the stakeholders, bringing in their voice to the process, and making sure that you've got appropriate training and awareness. I think that those are critical.
Yeah, governance is really, I agree with Heather, the foundational role in managing the risks of AI in healthcare. It's the framework, and I agree with Heather again. You don't need to rebuild governance. You need to leverage what you have. If you don't have it, you need to build the governance. But we need to make sure our innovation doesn't outpace safety and ethics or compliance. And this is kind of where things start to get tricky, because in addition to the regulatory compliance, we've got ethical issues around the use of this data. We have monitoring and auditing, and I started out as an auditor, and the way you audit AI is very different from auditing programs and processes. Today, it's a whole different spin. Risk management. We used to design our systems with human in the loop safeguards. And the whole point of AI for most people is to get rid of the humans. And you've got to have the people in there. And then you've got to have strategic alignment that the AI you're putting in is really aligned with the clinical and operational goals. And it's not someone doing it to write their board reports for the board and putting patient information in there so they can tell how many of this case or that case. But governance is the guardrail that will let a healthcare organization innovate with confidence and assure that it's being taken care of. It can't just be a black box out there doing whatever it wants.
Yeah, and I'll say this really brings me back to the introduction of cloud, right? When everybody was talking about cloud and how that was going to turn the industry on its head, and it was definitely something unique, and people had to think of the intricacies of the challenges it posed. But at the end of the day, as both Heather and David said, this is about frameworks. This is about compliance. This is about taking the things we already know and adapting them for the unique challenges that this technology poses. But I think just like cloud, we'll all kind of get past this bump in the road, and we'll figure it out.
Yeah, and one difference I'd add is if we want safety and trust in our healthcare systems now, it's going to be incumbent on us as people working in the sector, whether you're a provider, a payer, or trust commerce, because we're looking at legislation sitting on Capitol Hill that would actually create a moratorium on regulating AI in this country for 10 years. A lot of bad things can happen in 10 years. So if we want that trust and confidence in our systems, it's going to be up to us this time. We cannot rely on the government to help us at this point.
Yeah, I mean, to that point, David, maybe hopefully the hopeful approach is that, if Congress does enact that moratorium, it's giving space to have a federal schema put into place, as opposed to what we're seeing on the privacy front, where each state is going its own path and imposing a lot of regulatory and compliance burden on organizations. Because even if the laws are relatively the same, every state still has its own nuance thrown in there, which means you're going to have so many different regulatory schemes that you have to pay attention to. And, if you're putting compliance that, making it that onerous, now you're really either potentially driving organizations away from using tools, which I think all three of you would say is dangerous, or you're running a different risk of, having someone submit a complaint against you that, you're just missing, not out of good faith, but just because there's so many different hoops to be jumping through.
And
Yeah, it would
it's
be.
interesting because we're starting to see that already play out. We've got, as I mentioned earlier, like 40 state laws that have been proposed right now. Colorado has already passed their AI Act. Other states are using that as sort of the template to push it through. California's pushed through a number of privacy, transparency, government accountability laws with respect to AI. So we're starting to see that. And I think you're spot on with respect to saying it's either going to be so onerous that we're not going to adopt it, or my feeling is we're going to start seeing people adopt it and hope they fly under the radar. So I completely agree. It'd be nice to have a federal schema around that.
Yeah, and so all three of you are just talking a lot about governance, and I think David, you kind of quipped, it's leverage what you've got, or if you don't have it, then you need to build it from scratch. Or you said you don't want to rebuild what you've got if you have it, but maybe we do need to level set and just talk about like what are like the key elements for a governance structure. And when we're talking about governance, what type of governance are we talking about? Is it operational? Is it data? Is it some combination, or is it something else?
It's all of those things and then a few others, Matt. And the problem with trust as well as safety is it has to be operationalized, and we haven't talked really that much about operationalizing trust. You are still going to have to add AI governance because we don't have other technologies that require model validation or bias monitoring or explainability and the kind of oversight I believe we're going to need with AI, because without that oversight, AI falls away. A lot of healthcare providers, I go into a lot of organizations, they don't still recognize and do data governance very well. They may do IT pretty well, but they don't do the data governance. And with AI going in and plucking data, you need to make sure you've got that. The other thing we don't talk about very much outside of the physicians probably is ethical governance. And we're going to have to address that. We talked about it on one of our planning calls, the shadow IT governance or the shadow AI. It's one thing if someone brings in a cell phone and they're doing stuff that they shouldn't, but when you talk about AI and we were talking about state laws and the variety of them, AI doesn't recognize our state borders. It just goes out and does what it's supposed to do. So it's going to be that. And then there's the community and patient governance piece of this. A lot of organizations did do this when they put in their EMR. They brought in patient committees and panels to help them. But we're going to have to do the same thing with AI because not everyone's going to want to feed someone else's large language model.
Yeah, and to David's point, I think we're going to have to take a different approach because of the adaptability of AI, right? Most of the technologies we put in place are pretty much static, but the entire point of AI is its adaptability, and it does change. And those changes can be anticipated to a certain extent, those changes can be planned. But things like model drift and, as David mentioned, bias exploitation, these are things that we have to consistently monitor for. This isn't a once a year and just check to make sure it's, under the hood and the oil's good, right? This is something that needs to be monitored closely all of the time, especially if it's being used for decision making, or with agentic AI, it's actually taking action upon those interpretations and decisions. So it's something I think we're going to have to step back from that kind of once yearly approach and take a much more proactive stance on it.
And I think also to harken back to the idea of the shadow AI issue, I think this is a challenge given how pervasive the use of AI is in people's personal lives as well. Like if I'm working in a healthcare clinic, I'm not going to bring in my phone that has its own EMR on it and accidentally use my personal EMR in place of it. But it is possible that I could bring in my my mobile phone and decide that I need to record this call because I want to remember what's happening. And there's not a way necessarily for the organization to police that. And that's where it comes back to, what's your existing governance look like? What does your awareness and training look like? What do your consequences for non-compliance look like? And making sure that that is very well known. And so that's like when we're talking about building out your governance structure, as much as we don't like to talk about it, monitoring for that shadow stuff and enabling consequences for non-compliant behavior is part of an effective compliance program. We don't like to acknowledge it because that's not fun to talk about, but it's imperative that we have those in place and that people know that they're real.
Well, and
Yeah,
vetting these models for use by the organization and the people there so that they don't have to resort to these secondary
Exactly.
methods, right, of bringing in an outside utility.
It could even be an
Right.
accidental. It could, if I leave something, an app or utility running.
It is interesting to note there was a study done this year about anomalies with AI, and it found that healthcare had the highest rate of AI-driven cybersecurity anomalies of any other industry. So if that isn't a red flag to everyone listening, consider it waived, and you need to start protecting against the shadow AI.
it's when you mentioned cybersecurity anomaly, David, what was the definition of it in the context of the study you were looking at?
It was mostly about unknown AIs out there, and the security tools they were using was to detect AIs that weren't issued or authorized by IT. So that there's the message. I can guarantee you there isn't a doctor who doesn't have an AI on his phone and isn't using it anywhere, and it's for a good purpose. But it does put the organization as well as the physician himself at risk, because I don't even want to get into the medical liability if the AI makes a clinical decision. But
Yeah, no, as you said, not even getting into the medical liability. And, this is a discussion I have with folks all the time is if, you send a tool direct to the physician or direct to any end user you might think about in a hospital or an organization, once they share data with you, you've now caused a breach because it is highly unlikely any individual user like that has the authority to sign on behalf of their organization. So kind of given all those risks about the shadow AI, which, I think all of you said is really just the new extension of shadow IT, which has been a long-standing issue. Um, what are the best ways that we can detect it? And then, beyond the education, are there any proactive steps that can be used to cut off access if an unauthorized tool is identified?
there are actually platforms, and Andrew probably knows more about this than I do, but they're AI security posture management, AI SPMs, and they actually monitor the network for AI activities, which allow you to gain some control, related to regulatory compliance. So if you're sending patient data, it's going to catch that. There's some ethical oversight in some of those tools, as well as the monitoring and auditing that should be in place. Risk management, it will look at the behaviors and say this is particularly high risk, or this is probably not bright, but it's not going to do you any harm. And then of course we come back to human in the loop stuff. Or if it's, I hate to say it, I have seen them as a CIO, but even renegade research going on, or research going on in a lab that hasn't been authorized, hasn't been IRB approved, it can detect those kinds of things around the AI. So just what healthcare needs, another platform to protect them from the first platform they just put in.
Yeah, and a lot of these technologies are using the ideas we've used for a long time, right? So, proxying things through to inspect what type of traffic is going through, or packet inspection, or whatever it is, right? And now we're just looking for different things. And it goes back to things like, bring your own device. Are you going to allow that? If you are you going to enforce mobile device management so that you can monitor the apps that are being used on those platforms? I think something like this poses a great enough risk that if you're going to allow personal devices on a network, you have to have some sort of mobile device management to keep track of might be putting them at risk. The information in healthcare institutions is far too valuable and far too sensitive to kind of leave it to chance. So yeah, it's certainly things we've been doing for a very long time from a perspective of monitoring the types of traffic going in and out of a network, but modifying it to look for something a little bit more specific.
So, you know, in the probably unfortunately very likely scenario that shadow AI is utilized and data is leaking out, or there's other, other kind of, unapproved consequences that are occurring, and you've identified it, is there anything that can be done to address it other than one, cutting it off and stopping it so it doesn't, present an ongoing issue, but is there any ability to reach out and figure out how can you kind of get the cat back in the bag, or is it really you're just going to be dealing with the fallout?
From my perspective, I would say embracing the technology internally within your organization is going to be the best defense against these types of issues. If you provide your employees with the tools necessary to leverage this technology in its vetted, reviewed, monitored form, that's going to be much better than saying, nobody can use this, and then them going out and using it in a secondary device or a secondary method. I think a lot of times we have approached a new technology with hesitancy and, kind of wall it off. And we found that it does have great benefits. And if used properly, we can, gain a lot from it. And I think as kind of unknown as AI is and how it works and how things, decisions are made, I think if we can find the tools that work best for our organizations, and we keep track of how they're being used and educate our users on what is appropriate to use them for, I think you're going to have a better chance than just trying to, wall off the city and hope no one uses it.
Yeah,
And
the quickest way to get AI into your organization without you knowing about it is telling people they can't have it. I completely agree with Andrew. We had, I remember in the early 2000s, we had doctors who were actually writing their own EMRs because we didn't have one yet. It all went away. We created the governance structure for a selection. You have to engage your stakeholders, the clinicians, physicians, nurses. You have to engage finance, operations, because when that stuff stops working, they're the ones who get shut down. And this is part of the operationalization of trust and confidence in these systems. If they help build it, they will follow the rules. If they have to sneak it in, there are no rules. So I agree with Andrew. Saying no is not the best answer, but you do need to be ready and prepared to start engaging those teams, building the governance structures, and rolling out some of the early rules about how and what and who and when and where and why, the probably most important.
And I'm a big advocate for communication and transparency from the compliance suite and the governance suite. Because the answer may be not yes, but not right now. And that may be because we have a strategic roadmap that we're following, and let me communicate that to you so that we're aware that these technologies are coming. And that gives you the time, as David said, to build out your governance, to build out your awareness, your training, so that they know the right way to use it. But they also know, okay, I don't need to try to sneak things in because they're building one for us, or they're implementing one for us. But I think as transparent as you can be in that process with all of your stakeholders, the less likely you are to get these things like the shadow IT or the misuse of the technology that exists.
And it seems like a component of that is, as you said, the transparency and, being responsive. Part of it is also encouraging potentially if someone sees a tool that they'd like to utilize, present that and allow it to be vetted. Don't just run off and use it thinking it's okay, but it might be that, you're falling prey to a sales pitch and it's, not quite what it's being presented as once you actually go through a thorough vetting process, but it's allow that process to happen, which I think then feeds into the governance theme that we've all been talking about, because that, vetting of solutions and testing and making sure that they actually perform the way that they've been presented as performing is all part of that process.
Absolutely. I feel that, we talk a lot about transparency and trust and ethical relations with respect to our patient community and things like that. And absolutely that's critical. But as a compliance and governance professional, that's also critical between you and your internal stakeholders. If your employees or your team don't feel like they can come to you and say, hey, I've got a potential solution, I think this would work really well, or even I think somebody might be using this inappropriately. Can you guys take a look at it? If they don't feel comfortable with that, then you're not doing your right job as a CCO or a governance professional. So I think building that in is critical to make sure that as an organization, you're using these tools appropriately and people are empowered to say, here's a good solution, or here's not a great use for this solution that I've seen people implementing.
Yeah, and one of the other things that's confusing is a number of organizations have bought a commercial AI and they use it. If the organization has an AI, they have certain controls over where that data goes. But if you're using the thing on your laptop, your Surface Pro with Chat GPT, or the Android that's got their device, their intelligence, or even Apple, you may not be able to control that. And what happens when you start using that device on both sides, there may be data going out that even the organization doesn't know about, because it's going out from your device because it was in your email, and they have the rights to take that data. So there's a lot of explanation and a lot of understanding for people. They see the organization has it, Chat GPT, so they go start using it, and now they've blended their devices and are jumping back and forth, and they lose some of that protection on a personal account. And no one sits down and explains that to you. So including the vendors who are selling it. So
Well, and I think going back to David's earlier point, the data management issues, right? And data classification. If the company is going to be, integrating a tool set like this, they're going to have to think very carefully about how data is managed, what access this AI agent has, how that information is segregated. You simply don't want hoovering up everything in the environment and being able to parrot that back to anybody that queries it from within the organization. So I think the implementation and vetting of these tool sets will also bring to light some of the deficiencies, to David's earlier point about the data management and data classification.
Yeah, so kind of picking up on that point of, the considerate deployment and the understanding of what data the tools can interact with and then be able to present it back. How does that factor into the assessments and the discussions that should occur with the vendors? Because I'm also going to take this from the approach of these tools aren't being developed internally, but are most likely being acquired through subscription or some type of arrangement with a third party.
So I think with respect to the arrangement with a third party, I think this is again where your third party risk management program comes into play, because I mean, in an ideal world, no vendor is ever going to be signed on without going through your third party risk management. We know that it's not an ideal world. But your risk management program should take into consideration things like, what is their financial health? That can make a bearing on how they're going to treat data. It could make a bearing on how much they're going to invest in security. These are things that you want to know. What are their relationships? Who are their sub-processors? And again, this goes into privacy. It feeds into sort of your security and privacy vetting around third parties. Who are they sharing data with? Are they sharing data across borders? How are they segmenting clients and customers? So I think engaging your third party risk management team early, or your procurement team, or however it falls within the organization early, is vital. Your legal team to review those contracts, because vendors are very keen on sliding language in. And when David talked about it, like you may be using a Gen AI solution at work that your work has approved, and they have the admin level rights to say, do not use this data to train train the model. And you might think that it's okay to use that on your personal device as well. But they word that very tricky. It says your option is make this product better for everyone, yes or no. Well, if you click, well, of course, I'm an altruistic person. I want to make this better for everyone. And now you've just shared your data to train their model. So it's little things like that. So having your legal department in, and I think David has said it multiple times, it's like you have to engage your stakeholders on this and make sure that there is an awareness of what this tool does and how data is going to be shared, so that, to Andrew's point, the data governance program then comes into play, where you can say, okay, we need to segment off what kind of data we're going to expose this tool.
And when it comes to third parties, I mean, the unfortunate part here is we can have contracts, we can have risk management programs, we can, vet them, but the same issues that we've been talking about this entire time related to, the internal organization are present in the external. There could be employees there leveraging other unapproved tools. There could be undisclosed use of AI. They could be touting that they have some functionality that, is unique and brand new, but really they're piping it through to another Gen AI tool. So it's unfortunately a risk that it's going to be very difficult to completely mitigate.
Yeah, and I think those are great points, and maybe kind of expanding in a different direction is how do you kind of tease out when a vendor is actually utilizing AI? Because it could be that, you know, you're not directly buying the AI tool, but they have it embedded within their product. So it's like, how do you recommend going about ensuring that you either know it's present, or how do you go about defining what will qualify as AI to a vendor? Because it's, having been at a company in the past, it's, our chief technology officer, his approach was from a engineering perspective. He's like, we didn't have AI. But if you're looking at how the industry considers it, he's like, yeah, we've got AI because we have these algorithms that can drive a chain of, interactive commands. It's not thinking, it's not react, it's, all built in to follow a cascade. So, it's not AI as you might as you might think of it from a very technical perspective. But if you're taking just a popular approach, it could qualify that way. So it's, again, how do you end up teasing that apart and then really making sure you're vetting appropriately?
Well, from my perspective, right now, AI is the shiny new tool. So a lot of your vendors are going to be right out there with it. Hey, come check out our AI. Now, to Andrew's point, oftentimes it's not their AI, it's somebody else's AI that they're leveraging. And so sometimes you do have to look through their integration documents and things like that. And you have to dig a little bit to find out that, oh yeah, the way that this algorithm is described, that is AI. Or, hey, why is this company listed as a sub-processor? What's really going on there? And so it does sometimes take a little extra digging than it might with one of your more traditional vendors. Looking through the T's and C's very carefully as well is really important, because they often kind of bury that in their privacy and security language around how they treat data and who they can share data with. I don't think that there's sort of a cookie cutter approach to it. Do ABC and you'll find out. But I do think you have to sort of look at it with I'm going to say a bit of a jaundiced eye, to make sure that you're sort of interpreting correctly.
Yeah, I think to Heather's point, first off, you have to make sure they're really using AI. I think there's a lot of kind of hype around that terminology. Back when I was in academia, cybersecurity was the big buzzword thrown on every computer science program out there to try and draw more eyes, right? Is it truly AI? Is it truly learning? Is it truly ingesting that information for, improving the model? But to Heather's point, I think it's going to be an onerous process. There isn't kind of here's a questionnaire, please fill this out, and we'll know everything we need to know. There's going to have to be conversations, and probably some difficult ones, especially because this might, bring us to an issue of, well, this is proprietary. I can't really tell you what's going on in the background. And so how do you work through those intricacies? But yeah, it's going to be a tall task, I'm sure.
We have an interesting analog, and I've been reading a lot. I think most of you probably know that the AI CEO made a statement earlier this week. We're approaching the singularity, and the week prior to that, Apple published a report pretty much saying the AI world is about to have a model collapse. and I've read some of I didn't read Apple's because they're a vested player, but I read some of the research they were citing. And we have a fascinating analog because one of the things that happened is the chat bots that we started see blowing up the world in 2022 or so have polluted the internet, just like the detonation of the atom bomb released radionuclides and other participants. So what most people don't know is nuclear medicine devices can't be manufactured anymore. They have to use old steel from sunken pre-World War II battleships that weren't exposed. They call them low level steel, so they don't radiate. Nuclear medicine is one of those areas, space exploration. And what I hope we can do is keep from polluting the internet anymore with bad data, so we don't train the new models on bad data that was made up. But this is really kind of a clarion call to us to get a handle on this at our individually, at our organizations, and as a nation, and globally, frankly, because the data's everywhere. But if we mess up things too badly now, recovering from that, how would you like to build a model that you can only collect data that's pre-2020? Well, just collecting that data and filtering it out is a massive and expensive project, but let's not make it any worse. Let's get a handle on it now while we still can.
Well,
And
not
those are
even
great
that.
points. Those are great points because it's, as we're already starting to get really close to the end of the hour, it's, looking forward and looking to the future, how do we control against some of those, potential outcomes you were just describing, David? And, what would all three of you like to see to help guide the development, so AI actually remains as a productive and beneficial tool, and then also so, we can hopefully, kind of, as we've been talking about all along, you know, create a, hopefully somewhat safer environment, because obviously we're never going to have complete security, but, how can we try to, create as strong a footing as possible?
Well, I think that goes back to, trying to vet and use the solutions that are most appropriate for your organization. So David mentioned, bad data, right? So a lot of these tools that are out there are trained on everything from the internet. We all know that most of the internet is rubbish, right? But we haven't even talked yet about things like, poisoning the model, purposely putting out information onto the internet that it will be learned from that influences negatively its model's interpretation. So using models that are developed specifically for the clinical setting or for the medical field or whatever it is, right? And not just using these kind of catch-all utilities that maybe have tons of information that's completely irrelevant or completely wrong. So finding those solutions that are most appropriate. I'm sure we're going to see iterations of different tooling come out in the next few years that build off of these models, but are honed in on a specific subset of information. That information is better vetted. And then going back to our early part of the discussion, monitoring, watching these models to ensure that the outcome of the decision is what we expect and what we have trained it for. There will be drift. The model will learn, it will adapt, and we have to bring it back into heel to make sure that it is producing what we expect from that environment.
And I would add on that, AI is going to, whether you adopt and implement AI or not, it should be a part of your risk model because somebody in your environment, in your ecosystem is using it. And it's going to impact your compliance. So I think for good or bad, it needs to be part of your compliance and your governance framework. And I would say, again, with the monitoring, this is not a set it and forget it. This is not the silver bullet. You're not going to plug it in and it's going to fix all your problems. It's going to change over time as it learns more. But that means that you have to monitor it and adjust it and make sure, just as you do a risk assessment for any other technology or any other governance framework, you have to do it on your AI as well. You have to determine what your risk tolerance is. You have to take into account your ethical obligations to your community, your transparency obligations, as well as your regulatory, and continue to monitor that and adjust the AI solution appropriately so that it does not compromise your compliance or security posture.
And so
Yeah,
from that, oh, sorry, go ahead,
I
David.
was going to say, I would just add, I know Andrew does a lot of IR work, and the model there is you need to be prepared to be unprepared and react. This is a case where we can't be prepared to be unprepared. We know what could go wrong, or we should, and we need to prepare for that now locally at our own organizations, as Heather was talking about. But we need to bring back at least the federal guidance for our federal agencies. And we need to be pushing our elected officials to either get on board with what's being developed in Europe, some good stuff, or get back to what we had in place, and we're developing guidelines and rules for this. This is one you only get one chance to miss on this, and if it's a miss, I'm not sure how you recover from that.
Yeah, I mean, it sounds like, unfortunately, that is a dire warning, but one, that I think, as you're saying, really needs to be adhered to, because, to your point, the models will adapt and grow so quickly once, we make any decision, that you can't pull it back, and you're not going to be able to retrace those steps. You're then going to have to figure out how can we essentially cut it off from that point in time and get back to a safer zone. Um, but hopefully maybe we can leave on a slightly more upbeat note. As we're getting towards the end of the time, I'll turn it over to each of you to see, can each of you share a pearl of wisdom about, AI and how you see its, use and impact on healthcare. So why don't we go in reverse from how we started? So David, I'll let you kick this one off.
Here's we've touched on it, but my pearl of wisdom is that AI should enhance human expertise, not replace it. The most effective AI applications in medicine are powerful assistants. They help doctors with diagnostics, they help streamline administrative tasks, and they offer predictive insights. But healthcare is deeply human. It's based on trust and relationships. It requires empathy, ethics, trust, and complex decision making that AI cannot provide by itself. The best outcomes come when AI is used as a supportive tool rather than a standalone authority. We have to get over the fact it's going to replace all us human beings.
All right, no, thank you. Andrew.
So David took mine, but I will say that embracing AI technology, I think, is going to be the path forward. I understand that it's new, it can be daunting, but just like as I mentioned earlier with cloud, there are significant benefits here that can help these organizations, take that next step forward in patient care and treatment. And it's something that I think if we embrace it, if we try to figure out the best way forward for our organization, we can avoid a lot of the risks that we have been talking about when it comes to people taking things in their own hands, and training those people and educating them on the value of those tools, how to use them properly, and how to avoid these kind of new attack surfaces that are going to present themselves. I think, trying not to pretend it doesn't exist, and trying to pretend it'll go away is not going to be the path forward. It is here to stay, and we should figure out the best way to utilize it to enhance what we already offer.
Yeah, and now, Heather, you get to close us out and come up with a different way to say the same thing, I suspect.
Great. Let me see what I can do. I've used this analogy before, and I think it's sometimes easy to blame the tool and not the person that wields the tool. Like, a hammer is a great tool if I'm building something, right? If I am putting two pieces of wood together, a hammer is a great tool. If I want to open my window, a hammer is not the best tool. It damages quite a bit. And so I would say, it's proper use. If properly used, absolutely, it can enhance our corporate accountability, our transparency, our trust with our patient community. But you have to treat it as a compliance critical asset. It's not just a tool. It is a tool that has to be wielded with wisdom and with precision. I'll say that. So incorporate it into your governance framework, into your risk model, recognizing both its pros and its cons, and it can absolutely be used to enhance your organization and its objectives.
Yeah, no, thank you. And thank you all for those takeaways and, all the knowledge and insight that you shared. I think it was a great discussion. And Carol, I'll turn it over to you to close us out.
Yep, I echo your sentiments. I appreciate your time. It was a great conversation. I will let everybody know that I'll be getting a copy of the recording out to everyone. And I'll include in that links to everybody's LinkedIn profile so that if you want to continue the conversation with Matt, Heather, Andrew, and David, see them on LinkedIn. I'm sure they'd be glad to answer any of your questions. Again, thank you all again, and everybody have a great day.